Schrupp, physical therapist.
And I'm Brad Heineck, physical therapist.
And today we're going to talk about a specific type of vertigo. And actually it's called, the initials are BPPV, Benign Paroxysmal Positional Vertigo. And you don't need to know that, but if you're diagnosed with this type of vertigo, the good thing about it is that it's very treatable. And we see many of these patients in physical therapy, and it just involves a certain treatment which we'll show you on another video. It's called the Epley maneuver.
Right.
But just to kind of give you an explanation of what's going on with this type of vertigo, this is your inner ear. Okay, and there's different parts to your inner ear, and this is very, very small. Brad and I were just talking about, we don't have any idea how big it is, but it's obviously very small because it's in your inner ear.
The location of this is in your ear, and it's, you know, if you remember from grade school, you talked about the eardrum. It's very close, but in deeper than the eardrum, but maybe the size of a pea. It's just a small but very critical part of your body that helps you with balance and keep you upright.
And in this inner ear, we have the utricle, and this is where normally you have these calcium crystals, or those otoconia. So they are real small little crystals, and this is where they're supposed to be. The problem is they start migrating up into these semicircular canals.
Now, let's clarify this even more. I don't think we mentioned that this structure is, think of it like a balloon that has these shapes like this, and it's full of water or a fluid, okay? And these crystals can be suspended and float around in that fluid.
Good point, Brad. Anyway, he's correct.
I'm trying to help out.
He's correct. And what the problem is that these crystals can, float up into one of the semicircular canals. I guess often the one that gives it most often is the posterior one, which is this one. And once they go up into here, they can displace fluid, which can give you that dizziness feeling, the nausea,
spinning.
Or they can, I guess in some cases, even kind of attach to the little philia, or little nerve endings there.
I just tell people that it hits the nerve endings and it produces these symptoms because I'm not as
sure attach onto it.
Right.
So anyway, Brad often uses this little device to try to give people a sense of what those little crystals
right.
look
like. With patients, instead of going through all the terminology and whatnot, to make it simple and a little quicker and right to the point, I talked about people with that fluid in there, and think about a little snow globe. Now this one right here, can you zoom in on that, Lindsay? Now these crystals, what do we call them again, Bob?
Otoconia.
The otoconia, and I just tell people there are little crystals in there because they're such valuable people, they got crystals in. Anyways, if you look at here and you shake this up, and you get those crystals floating around like that. Now the goal is to get those crystals to settle down, and they have to be glued there, so to speak, or actually cemented to where they need to be. What happens is they break loose, and that's why when you turn your head or you turn over at night, this happens, and those crystals starts to float around to be suspended where they should not be, and produces the symptoms of nausea and dizziness and all the vertigo symptoms that you have. So just think about those crystals in a snow globe, and we need to get those settled down to the treatment that we have on the next
video. Yeah, we need to get them out of here, is basically what we need to get back into here. That's what we...
And that's the name, is a positional vertigo, because you change the position, and that's how you treat it. Certain positions allow the crystals to go out of those canals and where they belong.
And that's what causes it too, is certain positions, generally.
Right.
And that's why they call it that type of vertigo.
Then sometimes it happens after a traumatic incident where the head is jarred.
It can after a head injury.
Sure. Yep. That's just one instance. So other times it's not explainable. What?
Nothing.
This is why I have to put up with that work. So we don't work in the same building a lot. We're different.
That's right.
We feel better about things that way.
All right. Thanks a lot.